Lee. How are you?
I'm fine. How about yourself, Kayla?
I'm good. I'm good. Thank you so much for
Wonderful.
taking the time to meet with me.
Oh, sure, absolutely.
If you don't mind, I'm just going to get started with asking you a few questions.
Sure.
Okay. So, what led you to working with seniors on their specialized insurance needs?
Well, I started out at Independence Blue Cross as a Medicare rep. And in the course of doing that, I'm sorry, not a Medicare rep, but a Medicaid rep. And in the course of that, we discovered that there's a lot of seniors who have Medicare and Medicaid. And so in those transitions from Medicaid to Medicare, there's a lot of people who don't understand the benefits of Medicare. They just look at it as, Social Security is going to take money out of my Social Security check to get Medicare, which is not 100% coverage. And so for me, I enjoy working with seniors. So this is a good thing for me to be able to explain to them the differences between the Medicare and the Medicaid and help them with their benefits.
Okay, perfect. And how did you get into the senior financial market, and what made you want to get into insurance?
In the course of doing this transition, working for Independence Blue Cross, I was actually put into the senior market and trying to help them develop understanding with the plan, putting an actual licensed rep in their home to go over the benefits with them of their Medicare. So I started out first as really kind of doing a light explanation, but sending a representative out to their homes to be able to understand the benefits. And I said, you know what? I'm doing this over the phone. I could be that licensed rep to go out. So I end up getting my own book of business in New Jersey, in Cumberland County and Gloucester County, actually going out to mature New Jersey residents who were Medicare eligible and going over the benefits with them. That was my first Medicare rep job here in New Jersey. I did that for maybe like 2 years, and then they transferred me over to the Northeast, where I was doing Medicare sales, going out doing home visits, doing presentations. So all in all, I've been doing this almost 29 years. It's been a while.
That's a long time, yeah.
Yeah.
What do you think are the biggest challenges that your clients face regarding their financial situation?
Most of them are just not prepared. They don't know what kind of costs they're going to be faced with. And you think, like for you and I, we work for a company, we have health benefits, and it's just totally different with Medicare. We have to take on different costs, and, we have to make different decisions. We have to understand Medicare, and then after that, understand the plans afterwards. So cost is a big thing, because now you may have a pension, may not have a pension, and you have Social Security that's taking money out of your check for your Part B premium, so you're on a real tight income. So you're trying to get the best plan for your buck, and a lot of people just don't know what things are out there for them. I think for me, it's just really financially, what should I do? What's the best thing for me? What's going to be the best bang for my buck?
Okay. And what are the biggest concerns that you help your clients resolve?
Really, it's come down to lowering their costs, for the plan. You have a traditional Medicare plan that's been out since Medicare started in 1965, where you pay for that supplement plan to pick up the 20% that Medicare doesn't cover. Those can be very expensive, and those premiums can go up higher as you get older. And it's just covering the 20%. It doesn't add the dental, the glasses, the hearing benefits, or prescription coverage. So you're already looking at a lot of premium there. So I do run into clients who have those supplement plans. And for instance, I had a lady just last week who was paying $538 a month in premiums. Of course, when she uses the plan, she has no out of pocket, but she has high premiums. So for her, she uses the plan maybe 3 months out of the year. And those other months she's paying premiums and she's really not using it.
Yeah.
So for me, I've divided a formula for her to keep her doctors, and mind you, switch her from the traditional supplement plan and go into a Medicare Advantage plan, or they also call Part C of Medicare. And with the Part C of Medicare, you have the Part A, B, and prescription drug coverage Part D wrapped into one. And those plans start off with 0 premium. And, now we're not looking at an 80-20 split in the way the plan gets paid. Now the insurance company is going to pay that doctor, that specialist, that hospital. And you also have prescription drug coverage. So for her, she ended up saving like close to $5,000 for the year, $500 a month. And she was just ecstatic. When I left her house, she was just in tears because she just didn't know.
Yeah.
So, those are the challenges I get, changing them into a plan that's going to cost them little to nothing as far as premiums, and then also matching their doctors, and also, of course, keeping their prescription coverage or keeping their prescriptions and allowing them to obtain the prescription that they currently take.
Yeah, that makes sense. That's what I hear the most, is that they just really don't know like what is out there and what options that they have.
Absolutely.
If you had a crystal ball and could see into the future for the next 3 to 5 years, what do you think is the biggest challenge that the senior financial market is going to face?
It's pretty much the same. Out of my 29 years of doing this, it's just that transition from people who are on group coverage, working every day, and then now we turn 65. What do I do? Now you're looking at maybe individual coverage. You may not have someone that you're working with that you can ask them, hey, what's the best group coverage to get? So, everybody has the same plan while you're working. Oh, I got this, I got that. But now we're looking at individual Medicare plans. Now you have to kind of ask somebody what to do. And that's usually the hardest transition, trying to go from group to individual. But then also it's the same kind of scenario for someone, let's say they're on Medicaid and they're getting medical assistance. Now we're looking at, I just turned 65. I'm trying to get Medicare coverage. Where do I start? And why are you telling me now I'm going to have to pay money out of my Social Security check for Medicare coverage? I never had to do that with Medicaid. So those challenges that's been in place, those still will be prevalent going forward in the next 3 to 4, 5 years going on, because the state prohibits reps or insurance agencies from really standing in front of people who have Medicaid. They don't allow them to do that. So usually the person who's on Medicaid going into Medicare, they're pretty much lost in the shuffle for a minute until they really seek out maybe a doctor's help that has a connection with a rep, or if they call Medicare. And even then, they still have to look at perhaps talking to a representative to help them understand it. So.
Okay. And can you just tell us a little bit about yourself and what are your hobbies and what do you like to do when you're not doing this?
Oh my God. I have 5 children. Well, they're not really children, they're adults. I have 2 in California and I have 3 here in Philly. And, I'm just so proud of each and every one of them. My daughters are hard workers. They have nice jobs. But it's my son. My son is 22 years old. He's on the autistic spectrum. And so that's my hero. We go out and hang out at the movies. We go baseball games. We're at going down to the beach. So, if I have some extra time, we're hanging out. There's been times when he's actually come out when I've done, like street events. He'll come out and help me out. And it's good for him because it helps him develop his social skills even more, So as far as events, I like working with seniors. So there's been times when, I've hosted senior balls where they can come to the casino. We can, dress up nice, and we can dance, we can eat dinner, and, give out prizes. And that's always a good thing to do.
Yeah.
So it's a lot of fun working with the seniors because, most of my family, they're seniors. So they come to me, calling me, what did I do about my insurance? So I'm spread thin from coast to coast. Call Lee. He'll tell you what's going on with your Medicare. So.
Awesome. Well, thank you so much for meeting with me today and taking some time to share a little bit about yourself and what you do, and how much you've helped other people.
It's been my pleasure. So if you have any other questions, I'm here for you.
All right. Thank you so much, Lee.
Thank you.
Take care. Bye.
Bye-bye. Bye.